AI in mental health care is often used outside of therapy, such as to support care and services. In this video, we will review some examples of AI tools specifically designed for mental health care, not general public chatbots or unregulated apps. A large amount of time in mental health services is taken up by admin tasks, such as manual note-taking and letter writing, during and after appointments. For instance, researchers have designed purpose-built AI tools for clinical settings that support this work using ambient voice technology. This acts as a scribe by listening to clinical conversations, transcribing them, and summarizing appointments into clinical notes and formal letters. This can save time for clinicians after appointments and allow them to be more present during sessions. The AI-generated notes and summaries have often been rated as a similar quality to routine documentation. However, they can be prone to error, especially in noisy environments. Importantly, these notes must always be checked by the clinician, and letters should be edited to include human observations that a scribe would miss, such as nonverbal behavior. In approved purpose-built systems designed for clinical settings, the data is protected by national and healthcare regulations in the same way as clinician-written medical notes. It is also important to recognize that using AI is a choice. Some clinicians find that taking notes themselves adds value to their practice, their reflections, or the therapeutic relationship. In those cases, choosing not to use an AI tool can be entirely appropriate.
Beyond day-to-day clinical tasks, medical records also generate a large amount of data over time, providing detailed insights into people's individual care journeys. AI's ability to recognize patterns in data can help analyze this information, including patterns in symptoms, behavior, and so-called digital biomarkers. These can include any useful information collected through digital technologies such as smartwatch data on heart rate and movement or patterns on smartphone use. This amount of data would be too much for one person to process alone and might reveal hidden patterns that are first difficult to find. Specially designed AI tools can be developed to use routinely collected information to notice patterns and provide insights that mental health professionals can use alongside their own observations and clinical judgments. Outside of mental health services, there are a lot of AI-based apps that advertise everything from journaling, mindfulness, medication reminders, symptom tracking, or therapeutic benefits. It's important to remember that these apps are very different from clinical tools that have been tested and comply with data protection regulations in clinical settings. Whether they are developed by a university, healthcare organization, or commercial developer, all of these involve sensitive personal health information. This means it's essential to understand how AI systems use and protect data before they are used in mental health care. If data protection and security are not appropriate, using unregulated or unsuitable AI systems may expose personal identity or confidential information. Entering sensitive health information into a public or generic AI tool is very different from using an AI system that's built inside a secure healthcare database. And even outside of healthcare, AI tools can require time, training, and adjustment, which affects whether they're appropriate in some settings. Ensuring AI is fit for purpose is essential in mental health care.